Hey guys, it's Talia, and my presentation today is on Down syndrome. So, what exactly is Down syndrome? If we look at the picture in the upper right, we can see that it is a congenital disorder marked by having three 21st chromosomes. The causes for this are often unknown. However, we do know that mothers older than 35 are at higher risk for having a child with Down syndrome, notedly 1 in 350 chance. Some physical signs include having a single palmar crease. So if you look at your palm, you have two creases. Those with Down syndrome tend to have one. Furthermore, stunted mental and bodily development. So this includes deficits in balance, speech, and ambulation, which are all very important when considering rehab. So, what are some things that we need to take into consideration with patients with Down syndrome? For one, they have higher rates of comorbidities with things like chronic heart disease, vision and hearing loss, and thyroid disorders. So, those are some things that we need to take into account when doing aerobic activity, balance activities, and even having hypothyroidism and fatigue later on in life. Limited balance, something that I mentioned in the last slide, has been shown to be effective when moving from stable to more dynamic balance systems. And then decreased tone, I will talk about in a later study. We will do weight bearing activities because they are very functional and they still strengthen those muscles. Lastly, demonstration has been shown to be more effective than verbalization, so we want to show these patients exactly what we want from them. So the first study I want to take a look at is involving Nordic walking, which is just like regular walking, except they are given ski poles, which helps improve their overall balance, which is why this is also a great activity because it involves dynamic balance, but you add in stability. It's also very specific, so this is an activity that this population struggles with. As we mentioned, ambulation can be a problem, so this is a great activity to implement with a patient with Down syndrome. This specific study looked at 60 minutes of activity, including a 10-minute warm-up, 45-minute walking activity, and 5-minute stretching and breathing routine, 3 days times 10 weeks, so a total of 30 days. And overall, they did find a significant improvement in step length, cycle length, and speed for these patients. PT interventions in those with Down syndrome are often implemented earlier on in life, which is why school-based physical therapy is a great way to assess the effectiveness of this treatment. One study looked at 35 minutes of school-based activities such as sit-to-stand transitions, self-care activities such as hand washing, and posture when writing the ABCs once a week for 20 weeks in children that were actually of an average age of around 6. This falls under the industry versus inferiority phase of Erikson's stages of psychosocial development, in which these individuals gauge their success based on achievement. So that's a great way to set up achievement in a school-based setting. Furthermore, 70% of these kids achieved their primary PT goals, which also shows that it's an effective PT intervention. The last study that I looked at focused on strengthening using body weight. So, as mentioned before, Down syndrome is marked by low muscle tone. Therefore, these body weight exercises can actually help with neuromuscular activation and overall strength of large muscle groups. This specific study looked at 3 sets of 8 to 12 reps, 5 days a week for 10 weeks of an exercise program including several exercises. I only listed a couple: squats, leg curls, and chest press included, and ended up with an overall increase of about 42% upper extremity strength and 90% lower extremity strength. So these are just some fit principles that I put together for some treatments for some of these patients. So for kids, you can do some prone playing with reaching overhead for toys. Also, you can do some dynamic balance and endurance exercises. So like walking would be a great one for those that struggle with balance a little bit more. And even for those with strength issues, you can do some resisted aquatic therapy as well. Thank you guys. Stay safe.